Welcome to Clicks and Coffee. Today we're joined by Matt Kelley, Regional Vice President of Operation at Personic Health. With a rich background in healthcare business development and operation, Matt has been instrumental in expanding Personic Health footprint in mobile wound care services across the Mid-Atlantic region. His leadership has been pivotal in integrating innovative care models that enhance patient outcomes and streamline service delivery. Matt, welcome.
Thank you so much for having me. It's an honor to be here. Appreciate it.
So, can you share a little bit about your journey into healthcare and senior care and what led you to your current role at Personic?
Sure. So I actually started my career in senior living back when I was in college. My father was in senior living. He was in operations at the time, and I was attending Towson University, and they ended up having a sunrise right by the campus. So I actually applied to be a concierge, and I got the job. And after a couple weeks of training, they asked me to do activities. And I, at the time, wasn't as outgoing as I am now. So I was a little unsure if that was something that I'd be a good fit for. But the executive director said, try it for a week. If you don't like it, we'll put you at the front desk. Literally after my first day, I remember calling my dad and telling him, I want to be a professional activity coordinator. And he chuckled a little bit because he knows I was very ambitious about like making money and other things. And he was like, that'll be a great start. I'm happy. And I'll just never forget the first activity I ever had to do was jewelry making. I walked into the activity office, and they had these little tiny beads to go on this string. And I was like, okay, this is kind of difficult here for them. So let me help. And I remember there was one lady that was so adamant about making the perfect little necklace for her niece or her granddaughter. And it warmed my heart. And one thing that I've stuck with me from my Sunrise days is they always used to say you get your paycheck when you come to work, but you get your second paycheck from the experience you have with the residents that live here. So I ended up graduating from college, was ready to take on, another role. And at the time, my dad had shared with me, when you're looking to grow into a director role, stay away from sales. And I said, okay, no problem. So I go and apply, and they're like, we think you should do sales. And I was like, here we go again. So I was like, all right, well, my dad has shared with me that sales is very stressful, very high risk. And, they kind of convinced me into what they had called a move-in coordinator position back then. Did that for 6 months or so. Ended up growing my sales career into a sales specialist, and then ended up being a regional sales manager for Sunrise, area manager of sales. They created a new position. Was there for about the first 9 years of my career. Then I went on to work for a couple of smaller companies, was the head of sales at Lorien Health Services, which is primarily skilled nursing, but they didn't have a lot of experience with the assisted living side. So I came in, was able to help jumpstart their program there. Then I went to work for a couple smaller companies. I actually was working in home health and personal care at the time. I ended up having a tragic experience where my brother passed away unexpectedly. So I was in a situation where I kind of needed the ability to control my own schedule while I was dealing with that, was helping support my parents. Being somebody that was in senior living, a couple months before that, my last grandparent had passed away. So it was a very traumatic 3 months for me. So I ended up starting my own consulting firm, and being able to have the flexibility was great. But then Dr. Hussein found me on LinkedIn, and I've never signed up for a job so quickly. We interviewed on a Tuesday. I was signed and ready to go by Friday. And I think what really drew me to Personic was it was something different. Not just something different in the sense of, oh, I could go out, this will be an easy sell because no one else is doing it. But just seeing the passion he had and the culture he was trying to build was exactly where I felt like I needed to be in the time. I felt that, I was very honest with him about where I was. I was not even a year off of my brother passing away. And he kind of, put his arm around me, said it was going to be okay, said, I'm going to be here to support you. And I've never wanted to work so hard for somebody in my life. And I've seen them go on and replicate that with other people here. I have somebody on my team now who tragically lost their husband last week. And to see the support that they gave to her and how they let her take time to heal and come back to work was remarkable. And I took over operations back in December, and I had a nurse practitioner that came on, and she lost her brother within the first 60 days. And I laugh because it's kind of just a coincidence that all these people get to experience this while I'm involved. So I can really see what kind of company this is. Being able to give her that flexibility was great. So I'm really proud about the culture that's being built here. And that was a big decision on why I came here. The other big decision was I had never seen somebody do the level of wound care that we were doing in the home. I had worked in home health, I had worked in personal care, I had worked in assisted living, skilled nursing, you name it. And one of the trends that I constantly would see is more care is wanted in the home. The first evolution of this was let's build an urgent care to help offload the hospital. Then it became, home health has been around forever, but how can we add another layer of services that are in the home? A lot of people don't have the money to be able to afford private pay personal duty care. So it's what other resources can be brought into the home. And this was one of the first ones that was being brought into the home along with primary care.
Yeah,
So,
can you
yep,
expand a little bit on like um, what Personic Health does exactly? Because
sure,
we went right into the culture, which I love, and I think we should totally go back to that because to me it's one of the most important part of running a company. But really, what is like the specialty of Personic
sure.
and yeah, how did they do things differently?
So, Personic, the best way to describe us is a mobile wound center. So, we provide the exact same services outside of hyperbarics by the bedside. It's funny because the founders were all brothers in law. Two of them were physicians, and they would constantly see patients come into the ER. They would send them home with what he still claims is the best wound care orders ever. And the patient would come back within 30 days. And so they kept thinking to themselves, where is the gap here? And it's not that wound centers don't do a good job. Wound centers do an amazing job, but there's a lot of people that can't consistently make it to the wound center. And in order to get a wound healed, you have to consistently make it to your appointments. And one of the things that's made us so successful is we're really not doing anything that's different from the wound center. But the term we like to use here is convenience equals compliance. And our cancellation
Yes.
rate is under 5% right now. Maybe it's at like 6%, but it's very low because if there's a practitioner at your door, you're more likely to sit through your appointment. So we use nurse practitioners and physician assistants to go into the home to provide a higher level of advanced wound care. Currently in the home, you have home health, which is a phenomenal service. They have LPNs and RNs. There's certain things based on their licensure that they're unable to do. So our team is able to go in, they're able to debride wounds, they're able to take lab samples to determine if the wound is infected. If the wound is infected, we can write an antibiotic for that wound to help it encourage to heal. And it was really cool because we did a research project the company was founded back in 2023, and we use an EMR called Wound Expert. And they gave us the analytic data that we heal wounds 22% faster than the national average. And that's against wound centers,
Wow.
that's against our competitors, that's against anybody else who's trying to heal wounds. And again, it's not that we have some magic recipe to healing wounds. Do we do things a little bit different than other people? Probably, but nothing groundbreaking. It's convenience equals compliance. You create a happy company culture. People are happy to work here. Our founders were very, very it was very important to them that we gave people work-life balance. Our practitioners typically see 30 patients in a week, whereas, there's some wound centers, I'm not here to bash them by any means. They do a great job, but they might see 20, 25 patients in a day. And, if you're seeing six
Yeah.
patients a day, 30 in a week, you're going to spend a lot more time and be invested in that patient's care.
And
And it's,
mentally, it's
yeah,
also a lot easier. It's the same thing. There is not gonna name them, but I recently went to get blood work at a very famous, very large company, and the lady was rushing me, and I'm like, "Hey, what's the rush?" It's like, she's like, I'm sorry, but I have allotted 10 minutes per person. I'm like, 10 minutes to do the whole thing? She's like, yeah. No
right,
matter, the problem, no matter if the person feels bad or whatever, it's 10 minutes per person. And 10 minutes later, it's like, move next.
right,
So and could see that she was a little stressed, it's like, it's not stressed about me, but stressed more about all the
right.
work that she has to do. So for sure, that makes a big difference.
Absolutely. And I think, unfortunately, healthcare is still a business. And people
Mm.
have to, these businesses have to make money to be able to sustain and stay open. And I think we often forget about that. And I think that's one thing that as I've grown in my career and taken on more leadership roles is, when I was with Sunrise and I was in a leadership role, they were very team oriented, very resident first. But at what point do people start to become numbers and not people? We're talking about people passing away as, oh, we had 5 deaths this month, as opposed to, here's the 5 people who passed away, let's say a little prayer or something about them. Sunrise is really good about that, but other businesses were not necessarily great about that. And you start to get exposed more to that when you start to get to these higher levels and see that it's a business. One thing that I love about Personic is we're patient first. Very rarely was I on calls where we were talking about, the financial numbers and you're in the red, you're in the black. It was, what's the patient care? What are the outcomes? What can we do to get better? And I think that type of mentality has really attracted top tier talent to come here. And I think it's really made a difference in what we do on a daily basis.
No, no, for sure. And it's not funny, but like a lot of people that I had on the podcast and entrepreneurs that are like that, meaning that they care about everybody. And it's like when I say it's like the people, the team, and then the patient, and usually they have very interesting story and feel a lot better about what they do because they know it's a good job and the business just takes care of itself because everybody likes it. People are happy to be there, and patients are happy to refer you business because you know that they're gonna get taken care of
Absolutely.
properly.
And I think, as a new company, everybody experiences growing pains. And one of my old friends, her name's Laura Fisher now. She used to be my operations partner when I was with Sunrise, taught me a lesson very early on. I'm a sales guy. I think everything should be done perfectly, right? Well, that's not the reality we live in.
Mm.
And so she would teach me, we're people caring for people, and people make mistakes. And it's not preventing every single mistake, it's how you handle the mistakes when they happen. And that's something that has always resonated with me. And when we made our mistakes with Personic, there's plenty of phone calls that I would have loved to ignore and not picked up and listen to what they had to say on the other line. But I took every single call and I took every single issue that came across very seriously. Now, nothing tragic happened, but what might be a little thing to me could be a very big thing to somebody else. When we're working with seniors, sometimes we have to put ourselves in their shoes and try to experience what might be their reality. So if we're telling you that we're going to be there in a 2-hour window and it might be 2 minutes past that 2-hour window, they're thinking you were going to be here at the front end of that window and they may have been waiting for a while. And so, those are things that you learn as you start to grow as a business and try to start to perfect some of the customer service pieces along the way.
So I have one thing I would like to ask because you went
Sure.
from business development to operation. So
Sure.
how did that transition, how do you adapt to that transition? Because it's very different role. It's like one is
Oh, yeah.
really about, sorry, one is really about you know, getting the name out there, getting more clients, doing partnership, and then the other one is director of operations, so making sure everything
Yep.
works like clockwork, everybody's happy, dealing with the problems, dealing with efficiency. So, how did that happen, and how did you adapt?
So when I was with Sunrise and I was in a leadership role as the area manager of sales, and they had asked me to take on that leadership role in Kansas. Kansas was a market that was always an issue for us. We were known for having high turnover. We were known for not having the best care outcomes, and we were kind of known for not really doing this things the Sunrise way. So at that point, I was pretty well versed in how Sunrise had done things. I was a sales specialist. I'd go into buildings that were underperforming. But my partner, who I had talked about earlier, Laura, she lived in Texas. So she used me as her, what she used to call boots on the ground. So I got exposed to operations very, very early on. And I got to learn a lot from that. And then going into my next role, when I went with Lorian and I was head of sales, there wasn't really anybody that knew how to do the assisted living the right way. Did they do a good job? Sure. But there were a lot of things that I learned from Sunrise that I felt like could perfect the process. So although I held a sales title, I was very heavily involved in some of the operational things that went on. I also had some experience working at Brandywine, where we opened a brand new building. That was a very fun project for me because I got to work with one of my closest friends, Alfonso. He was the executive director, and he kind of leaned on me a lot as kind of his right hand man. And you're right, going from that sales mentality to operations mentality is completely different. So when Dr. Hussein had recruited me here at Personic, he basically, said, come in, build this market, hire salespeople under you. We'll put you in a sales leadership role. I'm good with that. That's my comfort zone. Let's do it. So we ended up growing very quickly. And we felt that the key to success was to have localized leadership. So our regional operator at the time covered Maryland, PA, Virginia, and New York. So he was spread pretty thin. So they wanted to go to a more localized leadership role. And a couple people had said, hey, why don't you throw your name in the hat? And I was like, you know what? I've learned a lot about what it's like to bring in a new leader from outside the company and try to mesh them into what you're already doing. And I felt like we had a good thing going. I saw what needed to kind of be cleaned up a little bit and where our areas of opportunity were. And I felt pretty confident that I would be able to do that. And so I kind of proposed it to the owners, and they actually were really on board with it and very supportive of it. And I feel like one of the things that I've been so blessed with here with this company is just how much support there is. It's little things like getting a text message here and there saying, you're doing really well. I can't believe you got that meeting. I can't believe we're growing this quickly. When I took over operations back in December, we're now going to almost triple the size of our team going into June now
Oh my
because
God, that's insane.
yeah, we're just getting it done. And it's like I joke with the owners, we're hungry here in this market. Like we want to be the best. And I think that starts from a top down mindset from the leadership team. And they've trusted me to do things a little bit of my way. And I saw a quote, and I'm not gonna be able to quote it as successfully as I had written on LinkedIn, but it was something about the fact of like leaders work for the people that they lead. And so whenever somebody calls me like, oh, I'm sorry, I know you're busy with all these things. No, what you need right now is the most important thing for me because you're not calling me just to talk. Because if you are, your tone would be very different. And it's so I look at my role as I'm here to remove all roadblocks so everybody can be happy when they show up to work and do a good job. And you're right. Going from, it's funny, a lot of people will tease me that they're like, oh, you're such a sales guy. You just convinced us to do all these things. And I'm like, well, part of it is sales. Sure. There's sales on a little bit of everything we do these days. But it's really, leading with the fact that I'm not going to ask somebody to do something that I wouldn't do. We started doing rounds at skilled nursings earlier this year. And we had a project that was about an hour and a half away from my house. They wanted to start at 7 a.m. And I was like, okay. So I got up at 4:30, got in the car, bought them all donuts, bought them all coffee, was there at 7 a.m., walk through the entire thing with them. And it made such a difference to my nurse practitioner that was there because she knows now that I have her back and I'm
Yeah.
going to lead by example in what I do and, kind of how we operate here. And I think that's been our key to growth because people buy in quickly and they feel like they're a part of a family here. If somebody's family member passes away, everybody reaches out. How can we help? What can we do? Do you just need to talk? And so I'm very, proud of that.
No, no, no. It sounds really amazing. It sounds really amazing, and I agree with you. Is That's exactly also what I try to do at Pentelope is try to be anything that I can help people with that I know it's blocking. I'll take care of that first, so that way we can in parallel do our work, and it's not like waiting on me and kind of blocking everything. So
Right.
I love that. That makes total sense to me.
And I think something that was unique about Personic that I hadn't experienced before was we're not backed by a hedge fund firm. So there's no one else that they're answering to except for themselves. And we're owned by physicians. So quality matters to them. And one of the things that I love that our CEO, Dr. Nakvi, does is on a monthly basis, he has an entire company town hall. And he gets everybody on a Zoom meeting and he gives everybody an opportunity to speak up, good, bad, or indifferent, and that's their opportunity, to have some time with him. And he makes himself accessible and he goes and visits different markets. And you feel good when you feel connected to the leadership team. So it's been great.
No, 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 totally. Because there is. there is the job and then there is the mission. And
Right.
do you feel like you belong? That's
Right.
also a very important thing, because we don't talk I know that more and more we talk about mental health, and to me it's important that when you show up at work in the morning you feel good about it, like going to work and being like, oh my god, again I'm gonna have to talk to Matt. And it's like, you don't want to go you don't want to do that job. But if you
Right.
wake up, it's like, oh shoot, I have to say hi to Matt, see how he's doing today.
Right.
Like, the day is going to be very different.
And it's
um,
funny because one of the first exercises I did when we had our first in-person meeting, when I took over the leadership role, was I asked each and every nurse practitioner, why'd you become a nurse practitioner? Most people aren't doing it because you're making a lot of money. And hearing each one of their stories is what I put back on them to remember their why, on why they show up every day and do what they do. Why do you care so much? Why'd you go to the extra school? You could have been an RN. You could have been an LPN. You could have been a caregiver. You could have been a doctor. Why did you choose this? And almost every single person said it's because they care about people and they want to help. And so when you're dealing with that difficult patient in home who's combative or might be bariatrics or whatever it might be, you got to remember that. And I've been a big proponent of remembering your why. Why is it that you get up every day? Why is it that you do what you do? And something you kind of touched on there was big, is like work-life balance. When I was young in my career, I was a grinder. I'd work as many hours as it took, didn't matter. But that came at a sacrifice because I
mhm.
wasn't disciplined with my exercise. I wasn't disciplined with my diet. I wasn't disciplined with my mental health. And unfortunately, all of those things came crashing down for me around when COVID happened. And that was kind of an eye opening experience for me of like, okay, this is the first time when I'm not busy. I have a lot of time to think and process. And these are some changes that I want to put in place. And kind of reflecting on where I was going wrong and being able to have some very vulnerable conversations with close people in my life really kind of changed my outlook on how I wanted to move forward, with my passions and with my work.
No, that's super. And we were talking a little bit before we started the podcast, the recording, that you seeing a trend in care, which is home care, like people are
Yes.
looking. And so what is your take on that, I would say, for the next couple of years? Because we know that senior living, or yeah, senior living, it's complicated, even though it's growing, and it's complicated in the sense that we're trying to build enough, we're trying to have enough people to manage.
Mhm.
And so people are also looking for home care. We're seeing also some new companies coming up with new ideas on home care and senior care, and really helping. Technology is helping as well. So what is your take, I would say, over the next 5 years, if you can think about that, or at least the next couple of years? How do you see evolving the market
Sure.
on that?
I think assisted living is great. Obviously, that's where I started my career. I'm a big proponent of it, but it's not affordable for everybody. You've got different tiers from group homes up to the most luxurious assisted living. It's probably going to cost you $20,000 to $30,000 a month. But there is a lot more demand for in-home care. And it's got to be care that's provided under insurance because a lot of people don't have the money to afford it privately. One of the things that made me very proud about Personic is the best payer for us, traditional Medicare. I think that's how it is for home health. I think that's how it is for doctors' offices and other services similar to us. But we take all insurances that we can, because we want to help as many people as possible. And I think now we're seeing trends where there's mobile physician groups. You can get a primary care to come into your home and do a doctor visit just like you would to go to the office. Recently, there's a company we partnered with that does in-home urgent care. So if you urgently need something, within 2 hours, they will deploy a nurse practitioner that will come out and triage your issues. There's mobile x-rays now that'll go into the home. You can get labs done in the home. So I think the real focus is offloading the burden of the hospital so they can really take care of the sickest of the sick and the people that need that level of care urgently for what can we do at home. We worked with a big hospital system here in Maryland, and in our first year, we shared about 110, maybe a little bit more patients. And wound care is one of the top reasons why patients readmit to the hospital. And I'm very proud to say that out of those 110, 10 of them readmitted to the hospital, and only 5 of them readmitted with a wound. And one of them was already a plan to readmit because they needed a PICC line. And that just goes to show you that there's a lot coming into the home and a lot of support in the home for those people that really need it the most. And I think with home health, unfortunately, for some reason, they keep getting their budget cut. And now you see, kind of scaling back some of the resources. So, how can other companies like ours come in and pick up the slack a little bit? We're going to take those patients, whether they qualify for home health or not. It's better if we have home health in there because they'll be in there several times throughout the week. But we're going to do the best we can. So I do think that you're going to start to see more and more services in the home. Um, we may not be that far away from hospital at home. I'm not exactly sure what that looks like, but
They'll
they're
come with a
seeing
bed.
better outcomes.
Yeah, they could come with a bed and kind of have like set up the whole thing. Why not?
Yeah.
And I was mentioning a little bit of technology. So how are you guys? So you mentioned that there is not crazy thing, but I think that with the story you're telling me and the success you're having, I'm sure technology plays a little role in what you're
Sure.
doing as well. And so, what are the things that you're seeing at Personic that you're proud of on the technology side that helped with also the growth?
So, one piece of technology that we recently used that's made a big difference for us is it's called mist therapy. So, currently, when people go to do a debridement, they'll use like a scalpel or a curette, and they go in, and most people know what a debridement is, go in, remove the dead tissue to help encourage healthy tissue to grow in its place. Some people can't tolerate that because it's painful for a lot of people. So, mist therapy is something that almost looks like a little tiny power washer that goes in and cleans around the wound and will remove that skin pain free. So to be able to have something like that you can bring into the home has been a game changer for us. It's nice because it's done multiple times a week. So it's one less visit that home health has to pay to have somebody go out for. And it's an extra set of eyes on that patient for us when we're in there. And we've seen some amazing healing outcomes as a result of that, being able to provide that procedure. The other thing I think that's cool is we're able to do dictations. They can speak into their iPad and do dictations that way instead of having to go home and type everything up. Then we can have a scribe come in behind them, clean up whatever was dictated incorrectly. Then the practitioner can come home and sign. And that takes a big burden off of them sitting there and charting for hours and hours and hours, clicking through all the little clicks that their needs. When you're working for Medicare, you're going to be very tightly regulated. So you
Yeah.
got to make sure your documentation is clean for sure.
No, that's great. It's funny you're talking about this because actually one of our client at Pentelope is a company called Mobius MD, which is a AI powered like dictation system that can integrate with most EMRs.
Sure.
And so it's exactly that. And I love those kind of technology where the point is to help you spend more time with the person and
Right.
not the bird and not replacing but really give you more free time, and that's what you guys also are trying to do. So same thing is like even instead of dictating and having somebody to transcribe, it would do everything automatically
Right.
and right there and then. So yeah, I love all those technologies. And to me, the way that I share my view of technology, especially in healthcare and senior care, is technology that would give back time to people so they can take care of people, because that's the problem with all the paperwork and all those things is not to annoy people, is just to
Right.
make sure that we have a standardized way of doing care. But the problem is like it's taking away the time for the good people to take care of people. And
Right.
so it's really more for people that don't do the work properly to make sure they do the work properly. But good people also get penalized because they have to do all that even though they're
Right.
already doing it well.
Right. After seeing 25 patients in a day, you got to go dictate for all of them.
Yeah.
I think that, AI is a big thing that's coming on now. And I think we're starting to look at some, different products out there that could do chart reviews for us. So instead of having our clinical directors sit there and sift through every chart, AI might be able to look through and find some of the holes or some areas of opportunity for us to be coached on. Or there's certain procedures that we have where you have to qualify, by having a certain lab done, an X-ray done. You have to have a stalling wound for a certain amount of time. AI might be able to go through the chart, pick all that out quickly, and then deliver that information to us. So it's going to be interesting to see how AI, comes into our field with wound care specifically. I know that on the
For sure.
product side, there's new wound vacs out there. Typically, they had to be changed 3 times a week. Now there's one that's 2 times a week. Apparently, there's one that can even be done 1 time a week. And it's funny because I hired a nurse recently who's an old school nurse. I'll just put it that way. And she told me about the day when they had to use the suction from the fish tank to put onto the wound, and that was their wound vac, and they're like taping it to the person, and I was just like, oh my gosh, the things we used to do back in the day.
Yeah, for sure.
Those poor patients, they're probably like, what is going on? I got an aquarium attached to me. But yeah, so it's been cool to see how technology's changing healthcare
Yeah,
for
no,
sure.
no, for sure. No, no, yeah, no. I'm very excited. I'm very excited. I really follow closely all of the new ideas, and yeah, and in the medical field, we're seeing it also with X-rays. I don't know if you're following that, but like the way that the AI can detect things that even the best trained doctors, you know, can do, but it's hard. AI can do it so much faster. So it's great for all the patients, and great, I would say, also for the medical personnel, in the way that now they have more time to take care of people, because at the end of the day, that's what's needed, because people are there, not their lowest, but they are usually, in a place that they're not happy with. Like the wound is never cool that you have to go, once or twice a week to the hospital to take care of your wound, because it hurts, it's painful, and so it's all those things that really
And
help.
and that was kind of the other big thing with Personic is we actually got a stat that people on average pay over $1,000 a month for those that can't drive themselves to the wound center, and that's a lot of money. And these are bariatric patients, these are bedbound patients that need medical transport. So if we can bring the care to them, not only are they more likely to show up for their visits, but they're going to save a little bit of money that way
A
too.
lot of bit.
Yeah, a lot of it. Yeah. Yeah. So, yeah, that's been great. And, you and I were talking a little bit about your experience at Argentum. Last time I went to Argentum, I was blown away by the technology that's coming into senior living. I mean,
Yeah.
there's now little bracelets that can predict when people fall or are going to have, a heart attack or a seizure. And you've got all these different things that people are putting in the room for patient monitor systems. We had talked about the consulting that I had done before, and I had worked for a company called Cavo that has some really cool technology that helps people do simple things like help their parent figure out what they're going to watch for TV, or reminders, or how about we text through the TV screen instead of texting on a cell phone? We can video chat through the TV. Let's start to use what's already there instead of reinventing the wheel. And it's been great watching a lot of these people with their tech try to advance what we're doing on a daily basis.
Yeah, and if you want to, really follow technology in the senior living industry, there is a company called Parasol Alliance, and they are always on it. So if you need
I actually
advice or
watched your interview with her. She's
okay,
amazing. Yeah,
yeah,
and I
yeah,
know I know Matt. He's a great guy. We were in a ambassador group together, and I've been following them closely. They're doing a lot of amazing work, and I actually really enjoyed watching her podcast with you. Just her energy and kind of some of the things that she talked about with her leadership model. I was just like, this is what we need more of, even
yes,
outside of healthcare,
yes,
because we need to give the power back to the people that are working these jobs instead of letting the people that own these companies rule what everybody does. So if you're stuck in a job where you're not happy and you feel like you're not being appreciated, people need to feel empowered to walk away knowing that there are places that they can go and the grass will be greener on the other side. Not always, but there definitely is a lot of great companies and leaders like her out
yeah,
there.
yeah, yeah. No, no, for sure. And so, this talk was very inspiring as a leadership lesson. And so, if you had, I would say, a little word of advice, advice for people that want to do what you're doing, and become, great leaders, what would you tell them?
I think the biggest thing for me, I was a leader at a young age, and I was 26 when I took on my first regional opportunity at Sunrise. And I had some really good mentors that helped guide me through some of the things that I didn't know I was going to face. one of them being younger than all the people that report to you. But I think during COVID, this is kind of when I had this come up, is you got to be able to take care of yourself first, not just in your job, but with your health, what you're doing to be able to support other people. Because if you're constantly stressed, if you're constantly burned out, people can feel it and people can see it. So, you know, take care of yourself first, find yourself some good mentors, and be somebody that listens first before speaking. I think a lot of people, when they lead, they hear somebody say something and they want to challenge it. Why is that person saying what they're saying to you? There could be a lot of different reasons why that might be. And I'm also somebody that's cheesy and loves reading good quotes. So go find yourself a page that shares a lot of good quotes and try to find the ones that resonate the most with you.
That's a good one. So maybe next time we can go over a couple of quotes together, and then
Definitely.
figure out the good ones, or at least like sort them. Like leadership quotes,
I'll give you
motivated
one
advice.
today.
Okay.
This is one that I posted on LinkedIn a little while ago. Success is not the key to happiness. Happiness is the key to success. If you love what you're doing, you'll be successful. And I don't think I've ever felt that more than how I feel today working for Personic. I wake up and people think I'm crazy. My girlfriend thinks I'm crazy because I wake up and I'm ready to go. I'm excited to go to work. Because when you build a team of people that are excited to do what you do, what's better than that?
No, 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 that's makes me want
So
to go and work for Personic.
come on down.
Oh,
No, and,
that
and it's been great getting to know you and kind of understanding, what you guys are doing over there. And I think you guys are doing a lot of good work. And I've loved watching a lot of your podcasts. And I'm going to stay tuned in to all the new people that you get on. And I'm going to try to watch some more of the ones that are already posted on LinkedIn. So I encourage everybody to tune in as new episodes start to come out.
Yeah, and if you want, you should look at Rob Librick from Goodwin Living. And
Oh yeah,
actually,
yeah, yeah, yeah. He's actually local here in
yeah,
our market.
he's
He's Goodwin's
very
actually one of our
impressive.
good partners here. Yeah,
Yeah, very impressive CEO. Very aligned with how you feel and your leadership ideas. So you should, yeah,
sure.
listen to the
No, I
podcast,
appreciate that.
talk to him because he's a very,
Yeah,
very interesting person. Um,
definitely.
and then looking ahead, what are the goals of Personic, or like what is next for Personic? So I know it's growth,
Right.
but what are anything extra you can tell us about the company and like where it's going?
So right now we're currently, and I think in about 12 different states across the country. We're looking at expanding to about four or more this year. We're looking to get deeper into the markets that we're in now. Here for my local team, we're ramping up. It's crazy to keep putting posts on LinkedIn to keep saying that we're hiring. And it's been fun. I mean, obviously, the more interviews you do, the better you get at them. But I think the future of Personic is just always trying to perfect what we do, always trying to make how can we be better at what we do? What support services can we add in? What else can we do to help patient outcomes? And, what else can we do to empower the people that we have here on this team to feel like they have growth here, creating more leadership roles, getting people more involved in projects that they're passionate about. We recently started doing rounds at skilled nursing. It was something we kind of stayed away from at the beginning just because there was a lot of competition already there. And we felt like, hey, we'll take them we'll have the patients when they go home. You can have them while they're in the skilled. People saw what we were doing and they were attracted to it and they wanted us to come in and take over some of those projects. And it's been very exciting for us. So now being able to see a patient in a skilled nursing and then follow them home when they discharge is a great value proposition that I think is going to take us a long way as we continue that program here for us. And there's a lot of new technology, a lot of new products that come out. So it's finding the right ones and kind of seeing what sticks here.
Oh, super! I'm very excited. That was a really a great conversation. Happy to
Thank
see
you.
people like you leading with their heart, and being empathetic, because at the end of the day we work with people, and so we all want to feel good. I think that's like the to me the main thing is like feel good and make others feel good.
Right. Right. Absolutely. No, I couldn't agree. And I am so grateful that you gave me the opportunity to speak and be on your podcast because you're doing amazing things over there.
Thank you, Matt. I'll talk to you very soon.
Thank you so much. Appreciate it.